So let's take one example. Suppose this is the Rasmika, our patient. Okay, when she was healthy. Okay, and this is his friend. Okay, both went for the forest first time. And they have the good time. They spend good time. They taken some of the photos. Okay, and they were very happy. Fine. So there is no any, we can say, changes in her physiology, not in her and not in him. Both are perfectly fine. Okay. But every time the things not go well. Sometimes there is a disturbance. Now, after the first visit, they plan. Okay. After the first visit, they plan for going to the next time. Okay. And around 3 months. After the 3 months, they again went for the forest. Okay. And this time. She went alone with other friends, not this her male friend. She went alone. Now this time, as you are seeing, she have difficulties. Okay, difficulties in breathing. You see the redness. It is seeing the redness, and she have a condition. It's not good. Yeah, it's not good. Now there is a difficulty in the breathing. Okay, she felt difficulty in the breathing. As well as there is a redness, there is a, you can see the respiratory sound is changed, whistle-like sound, we are referring as a wheezing sound. Okay. So, and her condition becomes so severe that she got hospitalized. Okay, she got hospitalized. Now let's move to the next slide, please. Yeah. Alright. Now, the second friend which went with her in the second time, that's him, he is like thinking. He is thinking what happens to her. Like what happens to her. In the first time she went with the, you can say, the another boy, and she is like fine. She is fine, no any problem. But now in this time when she went with me, why she has so many difficulties, she has problem. She has like he is basically thinking, okay, but the one thing which we usually face that why don't have so many patients? He always want to get his answer fast. Okay, so he go to the next slide, please. So he went to the doctor. He goes to the doctor and talk with the doctor that okay, he shared the history. He shared the history with the doctor about her friend condition, and doctor said many things. The one thing doctor said, just move to the next slide, please. Yeah, next slide. Okay, the one thing doctor said, as my friend described, that the condition, the second time her conditions is that there is narrowing in the bronchial tree. Okay, the respiratory tree got constricted, her lumen got constricted. And you can say there is a loosening of the mucus, okay, and that's why she feels the difficulty in the breathing, okay, and that's also explain why she have the whistle kind of sound or wheezing sound. Let's move to the next slide, please now. And you know, it's our choice to get satisfied from the things, okay, but that boy which is talking with the doctor cannot got satisfied just by understanding that her friend's bronchial tree got constricted. He had more desire to understand about her condition than the doctor described in detail about her condition, which I am going to share with you. So now what happened? During the first exposure, when she went for the first time to the forest, she had no any sign and symptoms. She inhaled the pollen grains through their nasal roots. She inhaled the pollen grains. The pollen grains is beautifully going into their respiratory tract. Fine. And you know, in the respiratory tract, as Alok said, there is the presence of some of these cells that we refer as an immune cells. Now, what happened? When the allergens come, that allergens we are using, that's the pollen grains. So allergens first comes in the epithelial lining, the first lining of the bronchial tree, and referring the bronchial tree to entire, you can say, the bronchial pathway. So the bronchial tree, first time the allergens come, and you know, whenever some, you can say, unknown persons come to us. So there are, you can say, the persons which represent those unknown person in front of our guardian. Because sometimes we performing these tasks. So same, one of the presentators said, as you are seeing, is here the dendrite cells. Fine, it's the dendrite cells, and it could be also the macrophages. For the macrophages and the dendrite cells, it is the one kind of immune cells which welcome any foreign particles. And here in our case, the foreign particles is the pollen grain itself. Yeah. So next, the story not end yet here. That these T cells, they represent to the another high class of immune cell, that's called as the T lymphocyte. It present to the T cell, and you know T cells is a kind of guardian, is a kind of responsible cell. It secretes some of the cytokinins. The one of the cytokinins, as you are seeing, is the IL-4, interleukin 4, interleukin 13, and interleukin 5. These are some of the cytokinins. Now, once they present to the T2 cell secretes some of the cytokinins. These cytokinins, it work on the B cell, another kind of immune cell. For your knowledge purpose, I'm just saying that the immune cells are basically divided into the two categories. The one category we refer as a B cell, another category we refer as a T cell. Remember, the T cells got activated, and it is the T cell which inform the B cell. Fine. So first the dendritic come, dendritic cell inform the T cell secretes some of the mediators, we are referring as the cytokinins. These cytokinins in turn activate the B cell, and you know what? B cell is like a fire engine. It secretes some of the IgE antibody. And you already noticed that during the investigation we found that IgE level is elevated. In our patient case. So it's explained why IgE is elevated during the exposure of the allergens. Here we have the pollen. Now, the story not ended yet here. This B cell, okay, which is activating the mast cell, which activates the IgE. Now, mast cell, this IgE antibody, they love to fit over the mast cell, and mast cells secrete some of the substances, which is really hectic for our respiratory system. The one of the substances you already aware is the histamine. Okay, it's a potent vasodilator. Yeah, it's a potent vasodilator. And one of the substances that is the leukotrienes. Okay, and those drugs which we studied in the drugs, those drugs, most of the corticosteroid drugs, they inhibit this histamine. Fine. Basically, they inhibit the binding with IgE and mast cell. Okay, that's the one way to manage the asthmatic attack. Now, this histamine, they work on the smooth muscle, and you see there is a constrictor in the smooth muscle, and there is a bronchospasm. Now, this IL-4, this is a very naughty kind of cytokine. It now goes to the another cell. It recreate or it admits some of our eosinophil cells. That's why you see also in the case of asthma, there is elevation in the eosinophil count. From the 1 to 4% in our patient, there is you can say the drastic increase, there is 8% increment in the eosinophil count. Now, once the eosinophil got activated, it recreated by the IL-4 cell, it secretes some of the MTB protein. Find this MTB protein. Now, this case is very difficult. It irritates the nerve supply. The nerve is supplying the respiratory system. That's the parasympathetic. One of the parasympathetic nerve is the vagus nerve. Now it's got to irritate the vagus nerve, and you know the nerves are basically meant for maintaining the constriction and relaxation of the muscle. So there is a bronchospasm. It's explained why patients have the bronchospasm. Fine. Now, the story not yet come here. The last story come to just 1 second. Okay. Now, to conclude this pathophysiology, as you seen, there's a trigger factor, and the trigger factors to lead to the airway inflammation, which lead to the hypersecretion of the mucus, airway muscle constriction, swelling bronchial membrane, which lead to all this all conclude to the narrow breathing passage, and that lead to the wheezing, cough, shortness of breath, and tiredness of chest. Now I will call Someji to explain about the signs and symptoms.